There's been a ton of stuff in the press recently about testosterone therapy for women. Is it a good thing? Is it a bad thing? Quite frankly, I've been prescribing testosterone to women of all ages for like over 10 years. And the reason is, you just see incredible results. As women, we need far less testosterone than a man does. And basically, like if we look at the reference range, for free testosterone, which is what's bioavailable for your body to use, because a lot of testosterone is bound to proteins and therefore it's in the system, but it's not really sort of biologically active. But for a woman, it can be up to around 3. It's kind of age based, so around 2 or 3. And for a man, it's got to be around sort of in the 20s. So I'm not giving women testosterone that I would give to men in the same dose at all, but just that tiny bit of a difference. The other thing I do is, I always measure the levels. I don't just give testosterone without testing it, because I want to see what the baseline is, and then I want to see how the person responds to treatments. And I recheck the levels when they're taking testosterone, which for women is often in a cream form that you can either rub onto your wrists. But obviously, if you're around children or pets, you don't have too much active product on your wrists or your lower arms. Then you could use your thigh, or you can use your lower stomach. And it works really, really well. I've seen from personal experience, I had extremely low levels, like almost 0. And it just made a huge difference to my mood, my energy, my get up and go, my focus, my concentration, my motivation, my ability to work out in the gym and recover quicker. It's been amazing. People often think, oh, it's just about sex and libido and sex drive. It isn't. So much of what gets you through the day in terms of your drive, your focus, your concentration, your energy can be dependent on levels of testosterone. And there are other things that can improve it, of course, like working out. But a lot of the women I see are extremely flat when I first see them. They have no motivation, energy, getting through the day is a struggle. And you're like, oh, well, what comes first, right? Maybe if you can have a bit more motivation, you can make different choices and then feel better. So I think it's a combined approach. If I could get someone feeling a bit better, so they go to the gym, so they make better food choices, so they, sleep and they can focus better in their job. I think it's a two-way approach. Like I said, I always check levels. People often say, oh, you get conversion from taking estrogen. In my experience, if you're menopausal, it's quite minimal. If you're perimenopausal or premenopausal, there is more conversion from estrogen to testosterone. That's in my experience of doing this for over 10 years, seeing thousands of patients. So I'm a big advocate of testosterone therapy. It's not always available from your GP. So sometimes you need to be referred to see a specialist. But if you think that this is an issue for you, why not get your levels checked and speak to a doctor about it? Because it really can make a huge difference. I would often do a trial of treatment for about 3 months or so, see how the person's feeling and recheck levels. I like to be data driven, but I also like to be personalized data driven. So what's going on with you and your levels, not just what works well for somebody who, general people. Let's see what's working well for you. So I hope that's helpful. And if you have any more questions about testosterone therapy, let me know. Bye.